appendicitis. The appendix is around 10 centimeters long, and it is at the beginning of the large intestine, from the small intestine into the large intestine, the colon. There's the appendicitis. And the walls of it can swell, or it can be blocked through hardened feces, or it can have kinking or something. And there is now an infection and an abscess. Now, and it is dangerous because it can develop into peritonitis if the abscess bursts, and that is then inflammation of the peritoneum, and that can lead untreated within a few hours to death. So, appendicitis, the symptoms are that there is at the beginning, so the symptoms develop over 4 to 48 hours. At the beginning, there can be some pain near the navel or on the right lower side of the abdomen, and it can come and go a bit, and after a few hours, then it is a severe aching on the lower right side of the abdomen. And the person feels sick, maybe cannot sleep, does not want to eat, and should also not eat, and should not take painkillers, and there may be a foul smelling of the breath, maybe a rise in temperature, and it can also be that the pain's going away again. Now, if appendicitis is suspected, it is not so easy to find it out because the symptoms are not so clear, but if it is suspected, the person should seek immediate medical help. And then it's talked about and discussed, and then looked for observation, and if appendicitis is suspected by the doctors, then it is removed in operation. After the operation, within 1 to 3 weeks, the person is released from hospital and is fit again. And it can be also chronic appendicitis. There is a vague unwell feeling there then over a few months or years. Often, most of the times, it does not develop into acute appendicitis, but it can. And there can be made an operation, and after that operation, removing of the appendix, the chronic appendicitis should be gone. So, acute appendicitis, pain in the lower right side of the abdomen, getting worse and continuous after a few hours, and it should be sought medical help as soon as possible, as soon as it is suspected, because it can be life-threatening. If it is treated properly, it has a very excellent outlook. That is according to Hodgkin's Family Medical Advisor on the page 78 and 79, but this is now medical advice.